We are here today to invite Fiji to join us in commemorating World AIDS Day 2013, which is the 1st of December, and this year falls on a Sunday. As President of Fiji and the HIV Ambassador to Fiji, I take this opportunity to acknowledge the work of partners, donors, CSOs, and friends in our combined efforts towards the Fiji response to HIV. I also acknowledge the lead role of the Ministry of Health in committing to mark this global event on the national calendar and reminding Fiji of the ongoing response to HIV and AIDS. As we focus on World AIDS Day, let us not forget that this is a day for taking stock of the challenges that humanity is facing because of HIV/AIDS, and for celebrating our successes in supporting the people affected by the epidemic. It is also a day when we make a firm commitment to sustain the achievements of the past decades and to do more, to do better, and to reach further for the eventual victory over HIV/AIDS. Indeed, we have come a long way since the first diagnosis and discovery of HIV almost 3 decades ago. With the appropriate approaches and methods that are applied today to prevent HIV infection, we now have a better grasp of what is needed to be done. The 2013 World AIDS Day, which is coordinated by the National Planning Working Group that is designated by the National HIV Board, will again recognize global achievements in the fight against HIV and highlight the progress Fiji has made and the shortfalls that we have experienced in the areas of governance, accessibility of services, and integrated prevention programs. Fiji's latest HIV statistics continues to remind us of the need to continue to support the response to HIV and AIDS. Although there is a reduction in the number of new infections globally, the same cannot be said of Fiji. The global response shows a decline in new HIV infections. However, for Fiji, there has been an increase of 64 new cases for the year 2012. That is 2012 alone, compared to 53 new cases in the year 2011, 33 new cases in 2010, and 43 cases in 2009. And with the 26 new cases to June this year, the cumulative total is now 508 confirmed cases since our first case in 1989. Now, this is a situation of great concern to all of us. Over 70% of the total is through heterosexual transmission, with the epidemic evidently affecting our young people, with over 50% falling within the age group of 20 to 29, while 80% of those infected are the Tauke population. These facts are undeniable. We should not be tempted to downplay the statistics and impact or to deny the reality that we face. At the same time, the epidemic is not about statistics. It is about people, about families, about communities. It is about our loved ones. Now is not the time to lament. It is the time to act decisively and to act together. Looking back over the past decade, the region has made significant progress in the AIDS response. national guidelines for implementing provider-initiated testing and counseling, including HIV testing and counseling for the key affected population, are in place. The number of sites providing HIV testing and counseling services in the Asia-Pacific region has increased by over 260% between 2007 and 2010, from 7,008 to 18,539 sites, and the number of sites is still increasing. Implementation of prevention intervention for key population is also an essential component of national HIV control efforts. This year's theme, as decided by the National HIV/AIDS Board, is drawn from the 3 zeros that the world envisages: 0 new infections, 0 discrimination, and 0 AIDS-related deaths. Fiji, for 2012, focuses its campaign on working towards 0 AIDS-related deaths. Fiji is encouraged by the progress it has made towards its response to HIV/AIDS. 1. The development of the 2012 to 2015 National Strategic Plan for STI, HIV and AIDS, which is also a guide to all key implementers in the implementation of HIV/AIDS related activities in the country. 2. The increase of HIV/AIDS counselors to conduct confidential trade counseling in public health facilities at divisional and subdivisional level. 3. The expansion of HIV testing sites from the 3 hub centers in Fiji to the subdivisional hospitals and health centers across the country. 4. The introduction of antiretroviral therapy and option B+ to pregnant HIV positive mothers as part of the prevention of mother-to-child transmission program. 5. The increase in the number of people living with HIV who are on antenatal treatment. 6. The establishment and implementation of the HIV/AIDS Decree 2011 and the establishment of the HIV/AIDS Board, which is the governing board for all HIV and AIDS related activities. 7. The introduction of a new HIV test algorithm to subdivisional hospitals. This will increase the point of care testing sites. I am certain that all these successes demonstrate that Fiji has taken a highly responsible posture and that by working together we can achieve much more. We cannot, however, afford to be complacent, because complacency is the worst enemy in HIV/AIDS response work. We must continue to work together. We must use the resources available for us to use efficiently and improve the effectiveness of our programs through better coordination and planning across departments and sectors, integrated service delivery, and systematic monitoring of all aspects of our HIV and TB programs. We must address the needs of marginalized groups to lower their risk of infection and to ensure early access to treatment when that is required. These include sex workers, young people, especially girls and young women, men who have sex with men, and the gay, lesbian, and transgender community. An area that remains of significant concern is the persistence of stigma and discrimination in our society, not only towards those living openly with HIV, but to other high-risk groups that I had mentioned earlier. Although the HIV epidemic has been identified as a profound and protective challenge to humankind, it has taught us many lessons. The epidemic has highlighted that addressing ill health is an intricate part of our development agenda, and our response has accelerated some of our programs, enabling us to tackle the underlying social determinants, such as lack of employment and housing, in a systematic and robust manner. As we continue with our campaign to get as close as we can to the zero mark, the National HIV/AIDS Board, through the Ministry of Health and the working group established by partners, have coordinated a series of activities around the country. Celebrations have begun in the Central Division with a free testing day for the community at the Fiji College of Medicine and Nursing in Tamavua, in partnership with YPA targeting the young adults and youth. The Ministry of Labour with the Red Cross Society, ILO and the Ministry of Health are conducting an HIV in the workplace training targeting workplaces within the Central Division. The Western Division have mobilized their communities for programs in Ratu, Tahua, Ba and Nan on November the 30th to the 6th of December as a build-up towards the World AIDS Day on the 1st of December. The Northern Division has also mobilized their community programs in Bua, Maduata and the Kaunrobe as a build-up to the 1st of December. A community campaign targeting the business houses and other workplaces as part of the World AIDS Day commemoration is facilitated by BA with the awareness of Wear Red Day on the 29th of November 2013. The main celebrations planned for the capital city will see two main events: a walk of hope on Saturday the 30th November 2013, which will be through the city of Suva to Victoria Courts starting at 9 a.m., followed by a breakfast and a sensitization program for the key affected population. This is coordinated and facilitated by FASNOC and FJN Plus with the support of the Ministry of Health. The main event on December the 1st, 2013 will be a prayer breakfast and meeting with the church leaders at the Holiday Inn from 7 a.m. to 10 a.m., a way forward for FBO's response to HIV and AIDS. This activity is supported by UNICEF. A few years ago, it was almost impossible to imagine that such progress could be evident in our country. By standing here today, I can confidently say that the journey towards an AIDS-free world has begun, and Fiji is definitely on that path. Our common vision of an AIDS-free country is possible and attainable. Let us continue to strive towards its realization. Our message is simple. Even though we are listed as a low prevalence country, we must redouble our efforts and stop the spread of HIV. We must reduce the rate of new infections. In this connection, we have too many cases of sexually transmitted infections. There is a definite correlation between the two. Prevention is our most powerful weapon against the epidemic. We need to strengthen strategic health communication strategies in our preventative program and also continue with our treatment and the continuum of care services, especially to our targeted population, to further reduce the number of new HIV infections. As HIV and testing and counseling services progresses, there is a need to strengthen the linkages between HIV testing and counseling and other established services to maximize uptake of prevention and treatment intervention. For example, what proportion of those tested positive have access to care and treatment? Each individual must take the responsibility for protection against HIV. To the youth, the future belongs to you. Be responsible and do not expose yourself to risks. Parents and heads of household, let us be open with our children and educate them about HIV and how to prevent getting it. We can eliminate the scourge of HIV if we all take responsibility for their actions. We have to overcome HIV the same way that it spread, one individual at a time. We have to really show that all of us are responsible. The HIV tests are voluntary, but they are confidential. We know that it is not an easy decision to make. It is a difficult decision, but it is a decision that must be taken by people from all walks of life, of all races, all social classes, all positions in society, because HIV does not discriminate. And I want to emphasize that government has declared several years ago that it will foot the bill for all antiretroviral treatment. So find out about your status. If you are HIV negative, well and good. If you are HIV positive, we can help you. We can save your life. That is our business, the business of saving lives. Let me use this opportunity as well to salute all our caregivers, including those neighbors who assist and support families in distress. We also thank our international partners who continue to provide material support to our campaign against AIDS. On this day, our hearts go out to all who are in distress as a result of this epidemic. To families looking after sick relatives, we wish you strength. We understand what you are going through. To those who have lost their loved ones to the epidemic, we share your pain and extend our deepest condolences. We have no choice but to deploy every effort, mobilize every resource, and utilize every skill that our nation possesses to ensure that we prevail in this struggle for the health and prosperity of our nation. History has demonstrated the strength of a nation united and determined. We are a capable, innovative, and motivated people. Together, we can overcome this challenge. Let today be the dawn of a new era. Let there be no more shame, no more blame, no more discrimination, and no more stigma. Let this be the start of an era of openness, of taking personal responsibility, and of working together in unity to prevent HIV infections and to deal with its impact. By working together, we can achieve these goals. As the President of Fiji and the HIV/AIDS Ambassador of Fiji, I have the greatest pleasure of launching the Fiji World AIDS Day campaign and its activities for 2013. Thank you. Shukriya. Bahut Dynamite.